Hello, everybody who is hopping in. Thank you so much for joining us today. We are just going to give it another couple minutes to let a few more people join, and then we'll get started.
All right. Thank you all for joining us. This is that awkward couple minutes where we're just kind of waiting for people to trickle in, but we are so excited for you all to be joining us. As Marina said, we're just going to give it another couple awkward seconds here, and we're just going to dive right in. Looking really good. Looking really good. Mm. All right, while we're racking up all those participants, I'm going to go ahead and get started. Well, hello, everyone, and welcome. We are so glad that you can all join us today for a very meaningful conversation about the challenges caregivers and older adults face, including the impact of isolation, mental health, resources shaping dementia care in Texas. This webinar is brought to you in partnership with the WellMed Charitable Foundation, a longtime partner of ours here at Blooming Health. We truly value their work and everything that they do to support older adults and family caregivers throughout education and creating those strong community programs. We're excited to showcase how Blooming Health has helped them with their messaging and our platform has helped their organization to save time so they can focus on their efforts. And with me, I'm thrilled to welcome May. May is actually one of my clients. I'm a little biased here, but one of my favorite clients. Thank you so much for joining today's discussion. I do want to start by saying, just asking if you can start by telling us a little bit about you. So tell us your title, how long you've been in the industry, and a little bit about your day-to-day.
Okay, first of all, thank you for having me and welcome everyone. I hope you take back a lot of information that we're going to share today. My name is May Bryan. I'm a caregiver support specialist for the WellMed Charitable Foundation Caregiver SOS program. I've been with the foundation for a little over 4 years. My day-to-day consists of following up with caregivers, connecting with caregivers, on a one-to-one basis, do support groups, networking with community agencies to bring more resources for caregivers and their families.
Absolutely, and such a great job that you all do. The amount of resources that you all provide and the spaces that you provide, the safe spaces for conversations that you all provide is amazing. I can't wait to kind of discuss that further with you. I do want to kind of dive in pretty deep and pretty quickly, talking about caregivers and what those kind of conversations look like. One of the things that I worry about, or we think about here at Blooming Health pretty often, are the warning signs of caregiver burnout and stress. Can you talk a little bit about that and what that looks like, how you see what are the signs that you see normally with those caregiver supporters?
Sure. So caregivers do experience burnout from time to time if they do not get any relief from stress. And there are some warning signs that unfortunately many times go unnoticed. And so it's important to recognize some of the early warning signs. And so some of the most common signs would include the emotional signs. A caregiver begins to feel overwhelmed, anxious, constantly worrying about what's to come. They begin to lose interest in activities that they once enjoyed. There are also physical signs. Caregiver begins to experience fatigue, tired, even if they rest. There's sleep disturbances. They sleep too much or they sleep too little. Same goes for their appetite. Many times caregivers will lose their appetite or they eat too much. Then it starts to affect their behaviors. And some of the signs for that would be withdrawing from friends and social activities. And they start to neglect their own personal needs and self-care as well. So Caregiver SOS does have a program, a stress testing program, which is an evidence-based program, and it is designed specifically for caregivers. And so it goes beyond understanding and defining what stress is and what it does to you. But caregivers during the structured sessions are able to understand some of these warning signs, recognize them early, and learn practical coping strategies like relaxation techniques, problem solving, and self care routines.
Yeah, absolutely. And I imagine in those times where caregivers are feeling burnt out and stressed, that it can be extremely overwhelming. And in your experience, how does the stigma around mental health impact older adults and caregivers that are seeking help?
You know, stigma is a pretty big barrier for older adults. Many older adults grew up in at a time where mental health wasn't talked about. It was most often misunderstood, and it was unfortunately seen as a personal weakness. And so they may not be comfortable discussing their own emotional struggles, and they fear being judged and labeled. And so as a result, they might avoid seeking help like when they start to experience any depression, anxiety, or grief. Or, they downplay symptoms a lot. And so it's important for us, for me as a caregiver specialist, to try to reduce the stigma through education, outreach, and peer support.
Yeah, absolutely. And for those supports, I mean, it can be friends, it can be family, it can be coworkers. There's so many different kinds of support systems for you all. Of course, your community-based organization that's allowing that kind of space to be able to speak through those challenges. So can you tell me a little bit more about how community-based supports can help ease isolation for both the caregiver and the older adult?
So support like support groups, activity centers, and all of these are resources that help build a network for the caregiver and the person that we're caring for. It helps promote well-being for both caregiver and the care recipient. Support groups is a wonderful place to come and feel safe. It is a safe space for caregivers to not only share their own experiences, but also gain emotional validation. They learn from each other. They feed off each other because they are sharing similar experiences. The WellMed Charitable Foundation also has senior activity centers. And although these centers are specific for older adults that are 60 and over, they can also be for caregivers. And these activity centers are wonderful. They provide an opportunity for social engagement. They have a variety of exercise classes and equipment. So it's able to provide a positive environment and stimulation for not only the adults, but also for their caregivers. Faith communities is also important. You know, it offers spiritual comfort and a sense of belonging, and which can be especially meaningful for during difficult times.
Yeah, absolutely. I imagine that activity is really affects the multiple things, right? Like being able to be active keeps you feeling stronger and capable, but also allows you the ability to interact with others when you need it the most.
Yes.
Really getting the blood moving, really getting that body moving. We know that that's so, so important when it comes to mental health and when it comes to isolation. And just speaking on that, just speaking on resources and you all as a resource, I want to ask a pretty dense question because I know that you all also work in some ways with dementia care and working with some of those older adults and families that are facing the struggles with dementia care. When resources are stretched thin, how does that impact the mental and physical health of older adults, particularly those with dementia?
So when a caregiver is feeling overwhelmed and under supported, it starts to affect their own health and it starts to affect the older adults, especially those that do have dementia. Um, for someone that has dementia, consistency and routine is essential. And so when a caregiver is stretched And even with small disruptions can lead to a decline in their overall well-being and cognitive and physical health. So if, for example, if the caregiver is fatigued or confused, they may begin to miss giving them their medications or taking them to their doctor's appointments. If a caregiver is tired and overwhelmed and might not feel like cooking for the day, they may just, it becomes easier to pick up something that is unhealthy. So poor nutrition
Mhm.
becomes a factor. And many times caregivers experience agitation and some behavioral issues, and due to their own unmet emotional and social needs.
Absolutely. And I do want to take a quick pause here and just mention to all those in the webinar today that if you have any questions, we are going to open the floor up for questions at the very end of the webinar. So feel free to flood that chat. We also have Marina kind of on standby as well, just keeping an eye out for those questions. So feel free to add any questions for myself or for May, or any questions you have about blooming health, dementia care, mental health. We're going to be talking all things at the very end here. Getting right back to our conversation though, from your perspective, I guess what are the common challenges? And you were speaking a little on this, in assisted living or memory care, specifically in Texas. So, for example, around training and staffing or supporting, those older adults.
So as far as assisted living facilities and those facilities, I can't really speak in regards to what goes on in there because I've never worked in one of those. But through conversations that I've had with caregivers, it's actually happened a couple of times where the resident is discharged from these facilities because of behavioral issues. They get too aggressive and they start to wonder. And so it makes me wonder if maybe more practical, real life scenario training would be critical to be able to manage these behaviors in these facilities. Also, the idea of qualifying for long-term assistance is here in Texas is with the long-term Medicaid for nursing facilities. Having those communications with the staff in the nursing facilities and having the residents and the families understand the process would also be really beneficial.
Mm-hmm. I mean, I have to commend all those that work with older adults and especially, caregiving and dementia. Like these are not easy avenues. It requires so much empathy and so much patience. Really, really does require a lot of patience because we're talking about people that are really having difficulties with either movement, just general movement that we take advantage of on our day to day, and general memory, just memory loss. I could not even imagine how much that affects the caregiver and the older adult equally, or differently. If you could change one policy, just speaking on that, and expand on a resource maybe in Texas to better support caregivers with people or people with dementia, what would that be?
Oh boy.
That's the question. Yeah, I know.
Yeah, that would be, I mean, I feel if Medicare would cover for respite care, that would be a game changer for families and for for everyone involved. I know that currently Medicare only covers limited respite, which is under hospice benefits. But having this coverage through Medicare, it would not only reduce caregiver burnout, but it would also help the older adults age in place safely and with dignity at home. It'll help families manage care at home longer and improve overall quality of life for the entire family, for the caregivers and the recipients.
Absolutely. And you talked about respite care, and we know respite care is available in limited ways. What barriers do caregivers face in getting the relief? Like what are the relief, like what are the pros of getting that kind of support, and what are the cons of not getting that support?
Right. So, I mean, I have this conversation periodically with caregivers regarding respite. And many times there's lack of awareness and understanding of what respite is and where they can get it. And even though these programs are available to them, they may not know how to apply for them. Navigating through that application process can be tedious, and so the lack of understanding and awareness in regards to these programs is a barrier. But I also find that one of the biggest barriers would be pride. Pride is a significant barrier. Many caregivers have this deep sense of responsibility. They feel that they could do it all without any assistance. And that may also apply for the care recipient. They begin to feel a sense of losing their own independence, or maybe they are a burden, or they do not want to be a burden to anyone else, and so they're not as inclined to accept help or any resources that are available to them. It's important on my end to empower the caregiver and to assure them that asking for help is strength, and it's not failure, and it should be seen as part of their own self-care, but also part of their loved one's treatment.
Mhm. Yeah, I
Mhm.
completely agree with that. I think it can be it can be quite a barrier for many people. Just that first step of applying, we see that across the board with so many different kinds of resources is unknown, like the uncertainty and the unknown of what happens and where to go for those applications, but what happens after, how long is it going to take? It feels so overwhelming to even think through and figure out all the steps that are needed, but also the care is so limited. It can feel very overwhelming to figure out like what those next steps are going to look like for their families. And I think that's a really good segue into Blooming Health and how much we've been able to offer and what we've been able to do for you all. So I do want to talk a little bit about your outreach, what it looked like before Blooming Health and what it looks like now. For all those, they may be new to what Blooming Health is. We are a mass messaging service that allows you to be able to contact your community in a very quick way. So we can contact people via SMS, voice call, and by email. We also allow you the capabilities of being able to survey your community. As we all know, information is power. So being able to access that part of your community very quickly is going to help you figure out what kinds of services that you're offering and how well they're doing. How satisfied is your community? What could we be improving on? Ways that we can be shaping our resources to better assist, better help. So I do want to talk about what that looks like before Blooming Health and what that looked like now as you are working into Blooming Health. I think at year maybe two, I think we're 2.5 years in now.
So when I started working today here, I would rely heavily on making phone calls. I had to organize support groups, and so in order for my caregivers to attend the support groups, I would rely on phone calls, sending emails, and many times even mailing out flyers for certain events. And so this process was extremely time consuming and many times inconsistent.
Mm.
Sometimes I had a support group the next day, and I had forgotten to make those phone calls. And so Blooming Health it really truly has transformed my workflow because it does allow me to reach entire support groups simultaneously. I'm able to tailor messages to specific needs. And I love that I'm able to schedule broadcasts or reminders months in advance. So it's pretty much a set it and forget it.
Yeah, absolutely. I feel like many people describe us as the set it and forget it kind of
Mm.
feature is you can really just go into the future, um, and just add all of your upcoming events, holidays, cancellations, notifications, all of that, within moments, duplicating kind of the same messages so you don't have to waste any time recreating the same types of messages that you might be sending. Because I know a lot of these messages are kind of recreations of the same
Mhm.
message. Hey, we have, caregiver support group, just a reminder next week. So saving you that time is so essential so you can focus on the areas that need your focus the most, which is planning, making sure they have the resources and being available to everyone in need. So your door is always open to those folks that need it.
Absolutely. I have support groups monthly and throughout the year, and so I'm able to schedule them way in advance because they are consistent, and so I just love that feature.
Mhm. And can you share, I feel like that actually is a pretty good example, but are there any other examples you'd like to give about whether there was like an in-person and or virtual support group where this really shined? You needed to send something right away and you were able to, and this was able to save you so much time being able to do that.
Well, it shines all the time. I've been using Blooming Health for some time now, and what I like by now, most of the caregivers that I have feel more connected and informed. Um,
Mm,
from the messages they do receive. And so I use Blooming Health to distribute invitations for monthly dementia series presentations that are hosted here at the Senior Center. And most recently, I've sent a mass broadcast, which consists of sending an invite to all the caregivers that are on my Blooming Health list to invite them to our annual Caregiver Summit. I used it last year as well, and it was both efficient and effective in facilitating the response, but also organizing the registration process. And it just saved me so much time because I did it all at once
mm.
in one mass message.
Yeah, absolutely. And a number of our clients also say that our users or the people that you're sending these messages to also feel some sort of connection to you a little bit closer as the recipient, the person sending off the messages, being able to feel like that you're getting that message. Some people even use us for check-ins. Hey, how are you doing today? If you're not doing well, being able to send a care specialist that information. So even that additional outer layer that we don't even think about, but getting those text messages could even be so beneficial to people that are feeling isolated. And we know how important and how big of a problem isolation is to the older adult community right now. We also hear from our partners that Blooming Health surveys give faster feedback for members. So, have you been able to use the feedback to adjust programming or identify specific resource needs from surveys?
Absolutely. So one of the things I really do like about the surveys is it not only highlights the good work that SOS is doing or that I am doing as a specialist, but I really appreciate the feedback of where we need to uh, improve to be more refined and expand our program. But I'm able to realize where I lack in there's certain gaps. For example, there was a caregiver that had put that she was having a difficult time getting a hold of me. And
Mm,
so that was really important to me because at that time I was able to reach out to her to have that conversation with her. And so this feedback leads to not only change but also the caregivers feel heard and valued.
absolutely. And we cannot forget that the identifying the gaps is so important. It's so crucial. So we're adding new resources. We're also improving on past resources, right? Like things that are available. We want to make sure that it's being utilized in the right ways, it's structured the right ways to actually be impacting our communities. So it's a really great example. I do want to ask because I think that many people have some hesitations, reservations around using technology. And I wonder if you have any advice to give any caregiver programs or community-based organizations that might be hesitant to maybe adopt technology like Blooming Health. So any advice you'd like to give to the group?
Absolutely. So I wasn't born in the digital era, but I have to say that I really do appreciate tools such as Blooming Health that make my workflow so much easier. It has made communication easier. it has reduced my workload in general, allowing me to focus more on what truly matters, which is a service that I extend to caregivers. Um, Not only has it allowed me to reclaim that time for them, but for myself as well. I have time to take a pause, take a breather, and focus on my self care as well during the workday, so I can continue to provide a good service to the caregivers.
Right. And I imagine, I mean, it's just thinking about it now that you're saying that, there's such a domino effect of overwhelm because of the lack of resources, the lack of what's available, the administration today, that domino effect of, the older adults being incapable and needing support, leaning on family members and friends, and then those folks getting overwhelmed, right, by their own need to taking time to care and to love and to be patient. And then for you all being overwhelmed on how many people need those resources and you're overwhelmed. And it's just a domino effect of overwhelm due to the lack of resources. And that is just quite astonishing to me. I don't know about you, but we so badly need so many of these resources. We're definitely getting less and less of those in this current administration. I do want to talk about the time saved. I know you were talking about that. So I know I'm putting you on the spot here to think about like how much time, but if you had to estimate per week how much time you really save in administrative tasks, with Blooming Health, what would you say around?
To be honest, I haven't really put much thought into an actual
Mhm.
time. But I mean, I think it'd be fair to say it's in the hours, a couple of hours around now.
Yeah,
Uh,
a couple hours a day kind of
making
situation.
making phone calls and mailing out stuff, that is extremely time consuming. Having to go to the post office to mail them out, it's time consuming, and stamps are expensive and stuff like that. And so, I mean, yeah, a few hours would be fair to say.
Yeah. And those hours really add up. You've got a couple hours every day adding up to the end of the week. Like that's the full day on your hands, really. So you're saving yourself a day's worth of work just by being able to send those messaging really quickly.
And
Now,
the
not
awesome part is setting it up and creating the broadcast and the messages. That doesn't take long at all.
Mhm. And saving yourself for the future, honestly. Future you doesn't even have to worry about it, which is great. We love that for future you. Awesome. Well, I do want to speak just a little bit more on Blooming Health and offer the floor up for some questions. Blooming Health offers so many different features. We are constantly adding new features. We now have an automation workflow, which will allow you to create kind of actions without you needing to go into the platform. So this ability will be able to allow you to send surveys and maybe based off of those surveys, create actions. So if you need to speak to a referral, let's say we send a survey on food insecurity, and we have assessed at the end of that survey, based on question 1, 3, and 7, that this person is food insecure and we want to give them resources and availability. So we want to refer them to maybe a food bank that's close by. Our system will now allow you to create that referral and it will do that action for you. Kind of like that automation that we're talking about with May now about scheduling those messages in the future. Our goal is to eliminate a lot of things off of your plate. We are constantly looking for features that we can build out to save you even more time. So the idea here is to eliminate the need of looking into the survey, analyzing the survey, contacting each person, sending out the messages, and allowing it to just kind of automate for you so you can create those actions. And there are so many actions. That's really just one example of the automation that we provide. I think it's probably our largest offering right now because it does connect you to third parties. You can add those third parties to the website. So you can just kind of do that without you needing to contact that food bank. It will automatically send to the food bank for you. We can also create those kind of same actions based off of broadcast messaging. So you can send internal broadcast messages with a list of people that have assessed were food insecure. So many really great use cases for that workflow. We're also really trying to create additional filters so you can reach specific people. So you can reach people that are over 65, maybe veterans. You want to send them resources specifically. So there's a lot that can be done on Blooming Health, and we are so excited to be able to offer this service and to be offered this new feature. I do want to make sure to showcase our QR code for anyone who is interested in talking a little bit more and brainstorming Blooming Health more with us. So we'll walk through your operations now. We'll find out what makes the most sense, how we can be focusing your messaging to specifically how you need it to work for you. So go ahead and scan this QR code so you can meet with us, create that meeting with us. In this wrap up, I have a few more questions for May um, that I think would be very interesting to get your perspective on. I want to find out a little bit more about what gives you hope in this field. So, despite all the challenges, what brings you that hope?
I've seen caregivers go through their journey and through their challenges, whatever that may be, and it gives me hope and the resilience of those caregivers and the growing recognition of the role of a caregiver in our society. Every time a caregiver reaches out for support, joins a support group, or advocates for their loved one, it reminds me that change is possible. And tools like Blooming Health, for example, show that innovation and compassion working together helps overall to improve lives, specifically those of caregivers and their families.
Absolutely, I completely agree with you. And if a caregiver listening today is feeling overwhelmed, what's one practical step that they could take tomorrow to feel a little bit more relief?
Mm, The most practical advice that I give to caregivers when it's like on at the moment, I bring it down to starting small. Relief starts with small but consistent actions. For example, I call them micro breaks. Take a break, whether it's 15 minutes, 10 minutes, 5 minutes, whatever that is, but take that time for you. It could be in the bathroom, it could be while you're taking a nice warm shower, it could be in your car. But take that moment to breathe, to stretch, call a friend, write in a journal, call your caregiver support specialist, but make that time specifically for you and schedule it if possible.
Yeah, actually, I do a lot of scheduling my own breaks myself, actually, and I've been working a lot more on not eating and working. I feel like I think that's a big one. I feel like people feel that if you can, while you're eating, you can probably be doing other tasks at the same time, but that time is so crucial for you being able to reset and working really hard on making sure that I'm not doing those things. But those micro breaks, scheduling them is definitely a big one. I think that's a great one to mention today. And my last real question here is just trying to give a little bit more highlight into WellMed. Are there any upcoming WellMed classes or programs that you'd like to highlight for the group?
Absolutely. So right around the corner, we are having our 12th annual Caregiver Summit, empowering caregivers to thrive. There will be an English session November 6th, a Thursday from 10 to 1. And then there is a Spanish session November 13th. So this summit is targeting caregivers, family caregivers and professionals as well. It does offer CEUs for social workers and nurses. I will be more than happy to add the link to our chat so you can look it over. And not only will this link take you to be able to register for the summit, you will also be able to navigate through our page and how it has all the caregiver support that we have to offer from one-on-one coaching to teleconnections. There are calendars for support groups, and so all of our information is in this website, the WellMed Charitable Foundation. I'll go ahead and add a copy and the link on the chat. Sorry about that.
Amazing. Yes, everyone make sure click that link, save that link for later to review. I know last year's summit was such a success and it was fantastic. So I would highly recommend attending if you have the time. Um, on that note of just giving one last shout out, I know we've done a few shout outs right now. We are doing Blooming Day in Maryland. We are going to be having educational sessions. It's a really great opportunity for networking as well. A lot of leadership will be there. We'll have some politicians there as well. It's a really great resource. So there is a QR code here if you'd like to register for Blooming Day, Maryland. We are also taking Blooming Health on the road. This idea of Blooming Day is going to be happening in multiple states. We hope to be in Texas pretty soon. We're working to make that happen. Um, but if you are going to be in the Maryland area, make sure and scan this QR code. Keep up with us on social media so then you can keep up with where a Blooming Day might be coming to your state. I do want to open up the floor for all of the questions. We already have some in the chat, so feel free to start flooding in some more questions there. I'm going to start off with question one here that I have. What are some major shifts you've seen in how communities or organizations are addressing social and health needs over the past year? I'm going to give that to May to start with. So, again, what are some major shifts you've seen in how communities or organizations are addressing social and health needs in the past year?
So social and health needs for caregivers, specifically, I've seen the shift of now caregivers are not just seen as a personal responsibility, but also somewhat of a public health issue. And so
Mm,
society is investing more and more in the caregiver and in their role, just like they're investing in healthcare or education.
absolutely. That's such an excellent point. Now that it's being hyper focused in that way, I think it's being considered as a real crisis, as you were saying, as this is something that we need to address because it is affecting people both emotionally and physically, for sure.
Mhm.
All right, question two here I have says for peers listening today who want to create similar outcomes, what's one lesson or piece of advice you'd like to share from your journey? So maybe some advice that you've seen in your years of working in the industry.
Journey, was that for me?
Oh yeah, I mean I can also definitely answer.
I said the journey for, but I didn't get that. Can you repeat the
Oh yeah,
question?
no worries. It's for what's one lesson that you'd like to share or piece of advice from your journey in these past few years working in the industry?
As a caregiver support specialist, whoa. I mean, I've learned a lot. Like I mentioned earlier, I've learned how resilient people can be,
Mhm.
and that hope that has been instilled with me um, regarding caregivers and how strong and how amazing they are and resilient, and how we can be, you know, that way when we're caring for someone that's so good. It's
Yeah,
incredible to me. Mhm.
absolutely. I think, and for me, I would say that in my past, just about 2 years working at Blooming Health, that the I think we underestimate how much the older adult community is willing, especially when it comes to technology. Like our direct clients, I would say about 90% of them are older adults. And we have found that when sending them those resources, via text message, voice call, giving them the opportunity to choose those channels of communication, so then they get the preference of communication that they would like, that they are very open to the technology. So I think it's very often assumed that the older adults are not going to be able to retain the information, know what to do with the information. But we have actually found that they have voices. Those surveys, they are so verbal about their needs and giving them the opportunity to receive those resources and seeing what the population will tell you what's going well and what's not going well. So really the technology aspect of older adults and what we think that they're capable of, I think is much more than we think. I think this is the last question that I,
Sade, I actually have a question from the audience, if you
okay.
would please take this one. Christy asked, have you had any challenges with patrons agreeing to receive messages from Blooming Health? For example, patrons, who are comfortable sharing their contact information with Blooming. Great question, Christy. Thanks.
Yeah, absolutely. I think we all kind of have that general fear of information and sending personal information. This is that time where many different kinds of communities are very, very concerned about that. Firstly, we are HIPAA compliant with our clients, but additionally, I think our clients know how to use this platform to the best of their ability. So none of the information is being shared. It's really based off of our ability to being able to connect you to the right resources, bettering your resources. May, did you have anything to add on that?
I actually do. I feel it's important to, especially when you're um, adding a caregiver to the Blooming Health. It's important because there are a lot of scams that are going on via text, and so it's important to build that trust with your caregiver, but also let them know um, the message they will be receiving will be from you. I always let them know. And the good thing is that on Blooming Health, you're able to customize the message. So I always let them know. I will put my name so they'll know that who it's from. I'll put this is name Brian from Caregiver SOS, and I will always put my direct office number. And it's building that trust. So when they do receive it, after a few times, they know it is for me.
Absolutely. And as May was saying, we have a lot of customization. So when you're onboarding with us for a free trial or officially onboarding with us, we do a number of things. One, we do add a caller ID, which you're going to be able to choose, which helps your older adults or community just better trust the system. You'll also get an introductory message. So you'll be able to customize the introductory message, which is about 7 to 10 seconds that just, hi, this is May from WellMed. Please listen to the following message. So we are doing everything we can to create that trust in the process and in the program. We also have an elaborate onboarding program when it comes to letting your users know in advance. Like even that will do so much. Word of mouth, just making sure you're talking about Blooming Health within your organization is also very helpful. But we will guide you through the entire process to making sure that you have the most successful launch. Our unsubscribe rate at this point is 2%, which is extremely low. So we do a very good job of creating that trust right off the top. Awesome. Let's see, is there one more question? Fix one challenge. Yeah, we kind of touched on this before, so it feels a little repetitive, but I want to see if we stir anything new. Let's just see if anything comes up. So the question is, if you could wave a magic wand and fix one challenge facing your organization or community today, what would it be? Hmm. I think for me, just thinking about that one challenge that we're facing, um, that I'd like our organization or community today to be able to, I would love I think that one of the big hiccups is being able to reach everyone that we'd like to reach. And it's very often complicated to be able to reach people with different languages. And I think that's something that not a lot of organizations kind of hyper focus on, right? So if we have people that speak a different language that we don't speak and we don't have a translator, I think that's one of our biggest challenges for sure. And I'd love for people to be able to eliminate that barrier because we want to be able to reach everyone that needs those resources. And on that note, Blooming Health is working on exactly that, creating and adding more languages to our platform so then we can reach everybody. So our platform today does automatically translate anything that you write in English to their preferred language, which just eliminates that barrier altogether. But of course, we are constantly adding new languages to the platform so we can eliminate that as a barrier altogether. May, did you have anything to add on that?
I did, and I know I mentioned earlier, I was not born in the digital era. I saw my first computer when I was in junior high. I'm giving out my age.
Mhm.
But I think it's safe to say that most of the people that I deal with, a lot of my caregivers, and their families were probably born around the same time that I was born. So getting comfortable with technology should also be implemented into our program
Mm.
because it's a sense of empowerment. Do not be afraid of technology, whether we like it or not. We're headed that way, and so getting more and more people connected and comfortable with technology would be ideal.
That's a great point. Yes. I see that more organizations are trying to offer beginner level, technology-based classes. And I think that that's such a great thing to add to organizations and communities. Technology is here to stay. So as much as we can help and assist those that would like to learn more about technology. I know one of my clients has a program specifically for emails. So they work with them on creating setups for automated payments and for opening those emails with those really great pictures of their granddaughters and grandsons. So even those classes, there's so many benefits to it. I think that's an excellent point. And I know I've got one comment here that I think is interesting. I'd love to address. I'd love for your input on this as well, May. It
Mhm.
says, in my experience, some of our clients express that they get too much information. I think that that's a solid point. And one of our key things here at Blooming Health, especially with the customer success team, is directing you in the ways of making sure that you're sending the appropriate amount of messages. We don't want to overload, right? They're already overwhelmed. We've been talking about overwhelm throughout this webinar. And the idea here is to create strategy around these kind of messages that you're sending out. So just to keep up with how many messages that you're sending in one day, how many reminders are you sending in one day? There are very specific like parameters that we like to share. So maybe one reminder per event is probably best. We don't want to send 2, 3 reminders for one event. So if you do that for maybe 10 events, now you're sending out 30 messages. That's too many messages to really be sending to someone. So it's really about aligning with your team, creating that strategy, and spacing out messages. Also, event reminders do mash up together, so then they only receive one message at a time for those event reminders for the day. So keeping that as a reminder as well is super important. So utilize all the parts of Blooming Health. Like, could you be sending event reminders in the broadcast message section? Absolutely. But if you send it in the event reminders section, it will mash together into one message, saving you those additional pings and text messages, right? Some clients do get overwhelmed, but thank you. Yes, clients, we do find that some clients will get overwhelmed just based on the amount of messages, and that's all about strategy, figuring out what's best for your communities and figuring out what kinds of messages to send out. May, do you have anything to add on that for your community?
Yeah, I feel like you do have to be mindful in regards to how many and how often you send out messages using Blooming Health. But I also believe that additional messages that people are getting, I get them, I'm sure you get them, all these text messages and all these offers, that may be contributing to them feeling overwhelmed as well. And it goes back to that trust that you build. Caregivers see that number, they know it's for me, so they let their guard down. And so, but when it comes to other text messages that they receive, we can't control that, but it's important to also validate, their concerns and also give them some sense of education, if you will, regarding those text messages, to be careful and stuff like that. So, but that may be contributing to them feeling like.
Yeah, absolutely. That makes a lot of sense to me. I know just looking at my phone now, I have 5 text messages from all the things, Bed Bath and Beyond, Urban Outfitters, whatever they are. And with that education that we were talking about earlier, that um, information on technology, that's going to help, right? Unsubscribe from those additional text messages, learn what's spam and what's not, but also creating that trust with our onboarding process and creating that strategy around what kinds of messages you're sending out and what are the important messages to be sending out, right? Because we do just want to be mindful of that. But when we're at Blooming Health, we're always considering that. That's one of our top questions. And we always tell clients, hey, just keep a brainstorm of how many messages that you're sending out, keep a nice little map of what you'd like to send out, what messages don't make sense to send out. And let's just create a strategy together on that. I think this was such a great conversation. Thank you so much, May, for joining us. I don't think we have any other questions here. This is a recorded session, so if you'd like to share this with anybody else in your industry, you will get the recording of this session. Want to thank Marina for creating this event, creating this webinar. Please be sure to join us for other webinars where we're going to be talking a lot more about the industry. Please join us at a Blooming Day, and please be sure to go back into the chat, find that summit link, and join the summit because it is worth it for sure. You will not regret it. Thank you again, May, and everyone have a lovely day.
Bye.